Karibu tena kwenye Afya Tips, kipindi ambacho tunakuletea dondoo na information nyingine ama habari za muhimu kabisa kuhusiana na masuala ya afya. Leo tuko live kutoka hapa AICC, Arusha International Conference Center. Hapa kulikuwa kuna mkutano wa madaktari wa taifa la Tanzania, lakini miongoni mwao walikuja madaktari kutoka mataifa mbalimbali, na niko na rafiki yangu ni daktari kutoka Zambia. Nitamkaribisha ajitambulishe, alafu tutaendelea na mengi ambayo tutazungumza naye kwenye kipindi cha Afya Tips siku ya leo. Jina langu naitwa Pantaleo Rugwisha. Karibu twende pamoja mwanzo mpaka mwisho wa kipindi hiki. Doctor, you're welcome to the show.
Thank you very much.
Our show is called Afya Tips.
Afya Tips.
Yeah,
thank you.
In English, do you understand the terminology? Or can I
No, you can
translate
you
for
can
you?
translate for me. Thank
yeah,
you.
it is health tips.
Health tips.
Yeah.
Okay.
So
right.
maybe can you introduce yourself to the viewers?
Sure. Thank you. So my name is Tolopu. I'm the president of the Mbaya Association.
Yeah.
I am also a neurosurgeon working at University Teaching Hospitals.
Okay.
Which is the largest referral hospital in Zambia.
Okay.
Yes.
That's nice.
And I'm here in my capacity as president for the Zambia Medical Association.
Okay.
I was invited by the Medical Association of Tanzania to attend the conference.
Okay.
So I'm happy to be here.
That's well. Yeah, and we are happy to have you here also. Maybe how do you see the Congress? Sorry.
Well, I think it's well organized. I like the venue itself. Number one.
Okay.
Arusha International Conference Center.
Yeah.
It's a beautiful place. I like the setup.
Okay.
And also the organization of the conference by the organizing committee. I think that is under the Medical Association of Tanzania. You can see that they really put in a lot of work into it, because the Congress itself has been executed meticulously, and from the first day up to today,
okay.
You can see that even time has been managed quite well,
okay.
you know, and the topics really also fit into the agenda of the program, the theme of the program.
Okay.
And so there's been quite a lot of lessons to learn. There's quite a number of similarities as well between Tanzania and Zambia.
Okay.
So I think of particular interest to me is the issue of ethics.
Okay.
Today somebody presented on ethics, and this is a growing concern, and it is also something that we are also working towards as Zambia Medical Association. We have actually gone further to introduce a short course on ethics.
Okay.
And all the medical doctors, and specifically also in particular for those that are just joining the medical fraternity, that are fresh from medical schools, it is a requirement that they will have to do this course on medical ethics and professional conduct, so that then they are well versed in that particular subject, because we've noticed that it is not heavily covered in the curriculum in medical schools. In fact, there are very few schools, if at all any, that cover professional conduct and ethics. And so we thought it was imperative for us to introduce it. Some of the similar discussions, some of the things that I've also noticed, taken note from this Congress, is healthcare financing.
Okay.
So we did have speakers talking about healthcare financing, and it's a similar model. We know that one of the pillars of achieving universal health coverage is healthcare financing. And Zambia, I do not know about Tanzania, is a party to the Abuja Declaration,
okay.
that stipulated that at least 15% of the total national budget should be allocated to health.
Okay.
And we're yet to see any African country that has achieved that declaration. I was trying to ask some colleagues from Kenya and Tanzania. I think there were indications that about 77% of the total national budget is allocated to healthcare. So we're still behind when it comes to healthcare financing. and we feel that it is very imperative that this is taken seriously. And also of note is the National Health Insurance Scheme also that was introduced here in 2023. We also have a similar scheme. It is called the NIMA, National Health Insurance Management Authority Scheme. So it's national health insurance that is managed by the NIMA board. And some of the similarities that I've noticed also is that it is easy to implement when it comes to the civil service, but it's quite a challenge to implement it with the informal sector, because with the civil service it's easy to just deduct from the source on the payroll, pay slip, but when it comes to the informal sector, it means that you need to constantly engage those people to ensure that they buy in and then they come through and make the payment to access health without having to pay from their pockets. So if you are contributing to the scheme, the insurance scheme, it means that when you're sick, you can easily just go to the hospital, and if you're a member of the scheme together with your family, you'll be able to access healthcare without having to remove money from your pocket. So those are some of the similarities that I've noticed, and really it just proof that we are basically just one people. We are neighbors, so we share quite a number of similarities. The people here have friendly, the food is quite similar. We have what we call shima here, you call it ugali. So we are basically just one people that are separated by these invisible borders, you know. So yeah, it's quite an experience, and I've enjoyed my stay here in Arusha, which is also a historic city. You know, there's the Arusha Declaration. You know, so it's really an honor for me to be here as a Zambian, and I also look forward to have the Medical Association of Tanzania join Zambia in August for the conference that we'll be having. As
representative of very critical association in Zambia, you are the president,
of course,
and you are the top leader in the association in Zambia. Where do you see the medical situation of African countries, the development, maybe 5 years to come, or the projections and whatever?
Yes, that's a very important question. So I think the goal ultimately is to have healthcare services as closer to the people as possible. You know, right now we see that we have healthcare services that are mostly vibrant in the urban cities, the urban towns. And so the goal is to see to it that we have healthcare delivery that is easily accessible for all people, despite their geographic location. So I would say I'm familiar with the Hazabe, the Hazabe tribe. There should be a clinic near there, you know, so that you're taking all the Maasai everywhere. So in our bid to achieve universal health coverage, then we need to take these healthcare services to as closer to the people as possible. And in achieving that, the top priority is healthcare financing, like I already said, and human resource for health. Those are key areas that we need to address. And we have been saying that we are seeing a lot of unemployment. You know, we have junior doctors graduating, and then they are currently unemployed. The question really is, have we really reached a saturation point when it comes to human resource for health? Do we still need doctors? The answer is yes. In my country, for instance, we are also talking about unemployment. We have medical doctors that are currently unemployed, you know, and yet we are constantly saying that the hospitals are short-staffed. So now we need political will, not only in Zambia, but most African countries. It's also a similar challenge that they're facing in Kenya. It's a similar challenge here. Also, we noted from the presentation that there is an increase in the levels of unemployment of medical doctors. Need and the other thing that we've been talking about is perhaps we have come to a time where medical doctors have to also actively participate in national politics, because who is best suited to address the healthcare needs of a country? It's a medical doctor or a person who is in a healthcare delivery setup or system. So we need to take a keen interest in the politics of our countries to ensure that health does not remain behind. There is obviously an emphasis on the economics of a country, but for any country to drive a fruitful economic agenda, you need healthy citizens. And so you cannot have an economically prosperous country that does not have healthy citizens. So first and foremost, health is very key. Health is very important, and it is imperative that all of us in the healthcare sector take keen interest in policy formulation and being part of the table of discussions with regards to issues relating to healthcare in the nation.
Yeah.
Yes.
So, two questions to go. The first one is, most of African countries, we are Africans and we have our culture, and you have talked about the presentation about ethics.
Yes.
On the Congress. We want to talk about the traditional medicine, African traditional medicine. Do you think is it starting?
That's a very important question. I was recently similar Zambia. There's absolutely nothing wrong with African traditional medicine. The only issue is standardization of the African traditional medicine and regulation of the African traditional medicine. We have seen oftentimes in our patients, we were receiving some traditional medicine, and because those medicines are not they do not have a dosage, so you may not know what quantity you are taking, and some unfortunately have come to the hospitals in kidney failure because those traditional medicines have knocked out the kidneys because of probably overusage of the same medication. So now the question is, what is the best way to go about this situation? So there has to be standardization. So to the extent that if a traditional medicine is available for treating a particular disease, it should be standardized. You should not have a different dosage from this traditional healer, a different dose from another traditional healer, or a different prescription from another traditional healer trying to cure the same disease. Chinese have done it. When you talk Chinese traditional medicine, it's standardized. If they're saying that they're going to treat hypertension with this Chinese medication, they're different that went in to ensure that they arrive at the right dosage, a dosage that is safe for the people that are taking it. So in a similar fashion, in my country, we do not have a regulatory body that regulates traditional medicines. I don't know how it is in Tanzania, but the core really is that traditional medicine is not bad because all medicines are coming from the trees and all those things. What we just need to do is to do studies to ensure that there is proven efficacy and also to arrive at a particular dose that is safe for the population that will be consuming those medications. Once that is made, we could actually even be exporting our own African traditional medicines, like we see around. Chinese traditional medicine has come through into the African market. You look around, you find that there's Chinese clinics doing acupuncture, they're doing all sorts of things. In a similar manner, we should not look at it as witchcraft, because there's a strong perception that traditional medicine equals witchcraft, which is not the case. What we just need to do is to ensure that it's correctly regulated, and then we have the right dosing, and then we continue to do research into this medication to improve the outcome when a particular patient takes the medication to cure a certain disease. Yes.
Now we are almost
Yes.
And my final question is, you are a neurosurgeon.
Of course.
I want you to comment on the status of neuromedicine in Africa.
Okay.
Yeah, the cases you come across, how to deal with them and whatever, yeah.
Yes, so neurosurgery is a highly specialized branch of medicine.
Yeah.
So basically, we address diseases to do with the brain and the spine, and the surgical component of it all. So we have very few neurosurgeons in Africa. In fact, just the other day, I was hearing that there are very few neurosurgeons in Tanzania as well.
Yeah.
And the majority of the neurosurgeons are in Dar es Salaam.
Yeah.
Which is similar to the Zambian situation. We have very few neurosurgeons in Zambia, probably maybe 15 or so, if not 12 to 15, somewhere there. And in fact, all of them are situated in Lusaka, which is the capital city. And then we have one that is in Livingstone, which is the tourist city of Zambia. So essentially there's a need to train more neurosurgeons. But other than just training, there's a need because for somebody to become a neurosurgeon, they have undergone extensive training. You talk about 7 years of undergrad training, and then you do 5 to 6 years postgraduate training. So there's a lot that has gone into that. And so some of the neurosurgeons feel that they are not adequately compensated for their skills in the public hospitals. And so we have people that are migrating from the public hospitals to the private hospitals, leaving the public hospitals starved of neurosurgeons. So patients will come through and then they will have no access to neurosurgical services. I think there's a need to train more. And then there's also a need to compensate them adequately and motivate them adequately so that they do not see the need to either move out of the country or seek greener pasture in the private hospitals where they feel that they will be adequately compensated for the skills that they possess. The other thing is that you see in Africa, a neurosurgeon will be getting paid the same salary as any other specialist, which should not be the case. I think specialists should be scored based on the extent of the work that they do, and they should be compensated as such, the same way that it is in other countries, because you start an operation from morning and then you end the operation later in the evening or the following day, and then you still get paid the same salary as somebody who maybe just came to work and then at 16 hours knocked off, which in some circles people have felt that it is not fair and they have opted to leave the public sector in search of greener pasture. So I think we need to do more as a continent with regards to neurosurgical services. The services themselves, they need to be supported. It needs to be at par with radiological services that are able to diagnose neurosurgical conditions, to enable the work of the neurosurgeons to be efficient, effective, and to produce results that will help the common people.
Okay. Thank you, Doctor.
Thank you very much.
Thank you very much for the discussion.
Thank you
for the
appreciate it.
And everything. It was
Thank
nice
you.
to have you here.
A pleasure to be here. Thank you.
Okay. Na mtazamaji wa SQF TV, hivyo ndivyo tunamaliza kipindi cha Afya Tips. Siku ya leo nilikuwa na daktari huyu kutoka Zambia. Tumezungumza mengi sana kuhusiana na hali ya afya kwa Afrika. Tumezungumzia kuhusu masuala ya tiba za Kiafrika. Daktari amezungumza mengi, ametoa comments zake kwamba tiba za Kiafrika sio mbaya, lakini ni vile tu ni namna ambavyo mamlaka ama serikali inaweza ikaidhinisha tiba hizo kutumika kwa utaratibu maalum ambao unaweza kuwa umepangwa. Lakini pia tumezungumzia kuhusu sekta ya upasuaji wa mishipa. Yeye ni daktari bingwa ama mbobezi wa masuala ya upasuaji wa mishipa, na ametoa komenti zake kuhusiana na hali ya matibabu ya sekta yake kwa Afrika, lakini kwa nchi yake ya Zambia na kadhalika. Lakini cha mwisho tumeongelea kuhusu uzoefu wake Tanzania na Zambia, utofauti aliyoona kwenye Congress hapa, kwenye mkutano mkuu wa madaktari ambao unakamilika hapa Arusha, lakini pia hali ya matibabu ama huduma ya matibabu kwa Tanzania ilivyo na Zambia, lakini pia hali ya utamaduni ama kacha tofauti iliyopo kati ya Zambia na Tanzania. Yote hayo tumeyaongea kwa undani. Hii umepata vitu na mimi nimepata madini mengi sana. Jina langu naitwa Pantaleo Rugwisha, nikushukuru kwa kuwa nami kwenye Afya Tips siku ya leo. Asante, mpaka wakati mwingine.
The Same Qualities Foundation kwa kushirikiana na hospitali ya Manispaa ya Kahama wanakuletea upasuaji wa midomo wazi utakaofanyika kuanzia Juni 30 hadi Julai 4 katika hospitali ya Manispaa ya Kahama. Watoto wafikishwe hospitalini hapo siku moja kabla ya kuanza kwa upasuaji. Kwa mawasiliano zaidi tupigie simu nambari 0769726782 au 0738229449 na 0717531312. The Same Qualities Foundation, hatua moja, tabasamu moja.